Hey everybody, and welcome to the Dr. Mom Show. It's Dr. D, mom of three. Thank you so much for joining me today. I'm so excited. I have a special edition of the Dr. Mom Show today because there's been lots happening in the past week since the last time I connected with you. First of all, I just want to say that I am so excited because yesterday, on Tuesday, I launched the Dr. Mom Show podcast. Woo! So excited. If you have not checked it out, definitely check it out. Some of the shows will have the same topics. Some of them will be a little different. So definitely check it out. Definitely, support small businesses. This is the way that people can learn about different diagnoses, but also remember that the Dr. Mom Show is an informational medical resource. It does not take the place of your physician or your child's physician. It does not give you a diagnosis or give you medical advice. It is information. So again, super excited about this tonight. I just want to encourage you. This happens this week, and one big thing, I don't like to call out names, is that there was. Oh, my internet is acting up. There was an actor who recently passed away due to colon cancer, and today I just wanted to do a show that COVID did not get rid of cancer. I know that everybody is obsessed and consumed by COVID, and now is a really bad time just in the viral situation because there's still different viruses, there's still different bacterias hanging around. So especially now that we're going into September, we are in September, people. So especially since we're going into September, we're starting flu season, RSV, all these colds, so rhinovirus, coronavirus, metapneumovirus. You didn't even know that there was all these viruses. So just a lot of viruses out there that can cause symptoms that are similar to coronavirus. So of course, things like fever, cough, congestion, runny nose. Of course, there's even issues with breathing. Sometimes they can be associated with pneumonia. So it's going to be some tricky times coming up here. But again, today I want to focus on COVID did not get rid of cancer. So we're going to flip the script here. And today I really just want to talk about colon cancer because it's something that's so important. I feel it's something that people take for granted. It's something that people don't want to talk about. It's like a PAP, where who wants to get a PAP, I mean, just to say it's not the most comfortable thing. But the other thing is, who wants to get endoscopy, right? I mean, I'm not looking forward to mine when that age comes. So not looking forward to it. I'm pretty sure nobody signs up to get a colonoscopy if they don't necessarily need one. And understandably so, because people usually don't want to go through a procedure if they don't have to. So today I just wanted to share with you kind of some preventative tips as far as screening of colon cancer, just to keep it on your radar and to be aware and be in tune of your family history, because your family history is so important and plays a role not only with screening for colon cancer, but also things like breast cancer, and just family history of cancer in general helps physicians, helps us to be more in tune and prone to look for things if somebody's presenting with certain symptoms. So again, something that's very, very important. So first, when does screening for colon cancer start? So right now, the average age it starts at is at least at 50 years of age. And you need, again, you need to discuss your risk factors with your doctor. So you need to, I got a little guess there, discuss your risk factors with your doctor, because some new guidelines came out, and sometimes they're screening as early as 40 in some patients. This is something you need to check with your insurance company, please, 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 because I know people end up blaming physicians when you get that bill, but please know that your insurance company is the ones who really run this medical system. I can't even begin to make that clearer. So they definitely dictate a lot that goes on. So if there's no history and you're just screening, normally 50 is when we start. Again, please talk to your physician about any risk factors or reasons that you may need to get screened earlier. Just so you know, earlier screening is indicated if there is a family history of colon cancer or colon polyps. There's something that's a polyp that it's almost like a skin tag, but it's a mucous membrane that's surrounded in like that skin tag looking lesion, and we can find polyps in the colon. Just so you know, we can find polyps on the cervix, we can find polyps in different areas of the body. Now with the polyps, what happens if physicians, usually either a general surgeon or a gastroenterologist, a GI doctor, those are the two physicians who can do a colonoscopy. If they find that, what they do is usually they take a biopsy of it, because there's different kinds of polyps. So some polyps are what we call pre-malignant, so there's an increased risk of it turning into cancer. And some polyps are benign, which means that they're non-cancerous, they're not pre-cancerous or pre-malignant. So it's important to ask your physician that if you hear the word polyp, to ask, oh, is it pre-cancerous or not? Now, depending on that, if you have a polyp that is precancerous or pre-malignant, you will have a repeat colonoscopy much sooner than somebody who has a polyp that isn't precancerous or pre-malignant or no polyp at all. So that's something you make sure you need to listen to. Now, there's different types of screening tests. Again, you need to discuss this with your own physician, because of course colonoscopies are gold standard, because with the colonoscopy, the doctors are able to see, and this is where your prep comes in. So if anybody has done a colonoscopy, you know that you have to drink that chalky stuff, although I will say they have come a far way with the cleanse that you do prior to it to get all that poop out. You can get some flavors and stuff, so you can always ask the doctor to help you out there. But something that can help you, and I learned this from my husband, is that, a lot of people do the cleansing the night before the colonoscopy, because normally the colonoscopy is scheduled in the morning because you can't eat anything. So usually people do it at night, and then what happens, the people are up all night essentially pooping. You're on the toilet, stuck to the toilet. But I learned from my husband, who he does colonoscopies, he encourages patients to do it the day before, and then just don't eat anything in the evening, and during the day just do a clear diet. So essentially a clear liquid diet, so like Sprite, that's really it, water. So not much, but at least you're up during the day already, and you can poop during the day. At least at night you can sleep, So I definitely, when I had heard him talking about that, and I was like, oh, I love that. I really do love that he says it. But again, talk to your physician, however your doctor does it. But I just thought that was a more convenient way of doing it, because nobody wants to lose sleep. I know I don't want to lose sleep. Every hour of sleep is very precious to me, because I try to be as efficient as possible. So again, that's a colonoscopy. But then there's other tests like cards that you can put your stool sample on, cups that you can put your stool sample in, blood tests as far as checking for blood in the stool, not drawing your blood, sorry. So there's just different tests that companies have come up with. Now, with the stool sample test, if you don't want to get a colonoscopy, those tests you have to do more often. just because, again, those tests are not as sensitive as a colonoscopy because, again, you can't see inside the colon. So, for example, let's say you have a polyp, what we talked about, again, quote unquote, like a little skin tag or a lesion in your colon. If you get one of the stool tests where you don't have a colonoscopy, that they go up into the rectum and take a look, there's no way to detect that you have a polyp unless it comes back positive for blood. That's the way it's abnormal. However, if you have a colonoscopy and you have a polyp, the physician will be able to visualize the polyp. So I hope this clarifies, how, again, everybody isn't running to get a colonoscopy, but how the colonoscopy is a little bit more helpful in the sense that physicians can see what is in there. It's just not a sample of your stool. So that becomes very helpful. Now, another thing is that, there isn't hard and fast rules that, if you do this, you won't get cancer. If you do that, you won't get cancer. But some studies have been done in people who have had colon cancer, and they change some lifestyle routines and their risk of recurrence, because again, with any cancer, there can be recurrence of cancer, these lifestyle changes. So diet is very, very important. High fiber is very important. Fiber keeps your stools, and I'm going to break it down, your poop, nice and soft and keeps you regular. It keeps things moving, and that's what you want. You do not want your poop stuck in your colon. The way the colon works is when it sits in there, the colon reabsorbs water. So that's why when you're constipated or you haven't gone to the bathroom for some time, your poop becomes what I call go poop. So it's like those little hard balls that you're trying to poop out. And that's because the colon is reabsorbing the water. So the stool becomes harder, literally, and then it is also harder to come out. And a lot of times people can get, and we see this a lot in little kids who hold their poop in, they can get something called encopresis. And that's when essentially they get a big hard ball of stool that's right there at the rectum, but it's not poking out or anything. So they have this old poop that's sitting there and hard because the colon's just reabsorbing this water. And then all of a sudden they'll get diarrhea. They'll have like poop stains, and they can't feel that poop's coming out. They get, that stool or poop leakage because they can't feel it, because the new poop that's coming down the colon is essentially going around what I call a poop ball and just coming out. And those patients can't feel it coming out. So parents will bring their kids in and saying that, the child is having these accidents, and they're not telling them that they have to go number 2 or to go poop or go to the bathroom. And essentially it's because they can't feel that they have to go because that poop ball's there. So the underlying issue is that constipation and keeping it regular, and fiber. And of course, that good intake of water helps with that. Of course, vegetables, fish, and whole grains in some of these studies have shown to be helpful with the decrease of recurrence of colon cancer. So the school of thought is, since some of these studies have shown that a decreased recurrence, that a healthy lifestyle, this healthy lifestyle that I'm talking about here, may potentially help to decrease the risk of cancer. And again, of course, I have to say genetics always plays a role. So that's why it's so important to know your family history, as I mentioned earlier, and so important to tell your doctor about your family history. The other thing is how important exercise is. So studies have shown that obesity is associated with an increased risk of cancer in general, so endometrial cancer, colon cancer. So men and women, it is so important for you to exercise. It is so important for you to get out there and be at a healthy weight. Nobody is asking you to be a size 2 or men to have a waist of 32. But the thing is, you just need to try and get out there, try to have a healthy lifestyle, and try to exercise as much as you can. And I know the current recommendations are at least 5 days a week for 30 minutes. But I always tell people, if you do nothing and you start doing even 2 to 3 days of exercise for 30 minutes, that is helping your body, your mind, your spirit. So definitely get out there if you can. Now, the other thing is, if you get a colonoscopy and something is found, they'll usually mark it. They also can take a biopsy. It depends on how big it is. Sometimes when they do the colonoscopy, they're able to say like, hey, that looks cancerous, and they end up, the surgeon ends up what we call resecting it or taking it out. And what happens is whenever they biopsy it, whether they can take out the whole mass or part of the mass, they stage it. And I'm not going to go through the staging because the staging is very dependent on, how big it is, if there are lymph nodes, and so if metastasis, and that just means if the cancer has spread to other parts of the body and how far it has spread. So there's a lot of factors that go into the staging, and based on the staging, that is how treatment for colon cancer is planned. So some cancers can be resected, if it's an isolated mass with no spread, no metastasis, it can be resected. Of course, if there's, if the cancer is spread, there's metastasis. Of course, then we have resection, chemotherapy again. And this is where surgeons and hematologists, oncologists, and cancer doctors work together. So that's why it's so important just for you to understand, again, just the screening, the importance of family history, how the cancer is staged, how the treatment is decided. And again, this is part of why I do the Dr. Mom Show, so you can know more, so you'll be able to ask more questions. And also when your doctor or doctors are talking to you, you can at least understand some of the terminology. So again, this is just something that is preventative medicine. Please, again, as I mentioned, nobody is ever rushing to me to sign up for colonoscopy, but it is something that's important. And I just want to add, again, we talked about that right now. The guideline is 50. There's some newer guidelines, like I mentioned, that have brought up the age of 40. You've heard me say it before, there's different medical associations, and there's always, everybody's not necessarily agreeing on the same guidelines. So we see that a lot because, of course, for example, I'll take breast cancer. So normally we start screening at 40 is when we start screening. Recently they came out with guidelines that you can start at 50. But of course, physicians like surgeons, cancer physicians, so those are hematologists, oncologists, radiologists, those are the physicians who read x-rays, MRIs, mammograms. Those physicians still stand firm. Those societies, I should say, stand firm that it should still start at 40. And again, it gets a little tricky because those are the physicians who are directly involved in the care of patients who are diagnosed with breast cancer. So I was just giving you that juxtaposing breast cancer with colon cancer, how the guidelines, again, it's not black and white. So the guidelines are not black and white. That's why, again, your family history is so important. This discussion is so important. And I have a show about how important your annual physical is. And this is for sure something that needs to be discussed at your annual physical. Of course, unless in between you're having, rectal pain, if you're having issues with pooping, if you're having blood in your stools. So of course, if you're having symptoms or anything, definitely get in to see your doctor. But if you're not having any issues and you have a question about screening colonoscopy, definitely at your annual physical or checkup, you should address that with your physician. So again, with the screening, if you do have a family history of colon cancer or polyps, the screening normally starts earlier. It's usually 10 years before that first-degree relative was diagnosed, or at the age of 40. So for example, if a patient has a father who was diagnosed with colon cancer at the age of 45, I will not wait until 50 to get that patient's colon cancer screening or colonoscopy. So 10 years before, that diagnosis would put him at 35, or it could be 40, but we always do the one that comes first. We prefer to screen earlier if there's such a high risk factor. So we would start that screening colonoscopy at 35. I hope that makes sense. But again, these are things that you can discuss with your own personal physician. So I hope this was helpful. This is a little deep. I just want to remind you guys that during this time of COVID, there are other things going on. So please do not be so consumed and focused and so just tunnel vision by COVID. If you're having any sort of symptoms with, anything, it could be anything with any part of your body, don't necessarily think that it's COVID. I know it's been a very overwhelming time because that is the information that is coming in, and it's just human nature that's what you think of, because unconsciously, that's just like surrounding everybody's mind. So I just want you to remember that there's other important things, other important health factors, not only social distancing, wearing a mask, good hand hygiene. Also, again, preventative. You'll hear me say this all the time, that preventative care is so important. So we want to prevent patients from having any of these disease processes or being able to find it in the early stages so intervention can be done. So I hope this show was helpful. Do not forget to like, comment, and share the video. And again, check out the Dr. Mom Show every Wednesday at 8 p.m. Eastern Standard Time on Facebook and YouTube. Or you can listen to me now every Tuesday on radiolove.com at 1 p.m. Eastern Standard Time. And that will be going on other platforms, including Spotify, iHeartRadio, iTunes, some other platforms. So I'm super excited about that. I can't wait for that because, again, I just really feel it's so important for people to be knowledgeable about their health and their bodies. Don't forget to check out drdalenemushalak.com. You can find all my books there. Also, I'm getting ready to put a little bit more medical information on there that you can sign up to do some fun stuff where you can learn and get healthy. So again, I hope you enjoyed the show. COVID did not get rid of cancer. And remember that other sicknesses and illnesses are happening. I hope you guys continue to stay safe, continue to have a blessed September. And don't forget to wash your hands, kiss your kids, love your family, and say your prayers good night. Bye-bye.